Okay, so let's talk about the naso-orbito-ethmoid complex fracture, NOE complex fracture. As the name suggests, those fractures are they involve the nasal bone, the orbit, and the ethmoid. So the fractures go throughout the orbit and involve those bones. And there are three types of those NOE, naso-orbito-ethmoid complex fractures. They are classified based on the Markowitz and Manson classification system. But the main idea, this is type 1, you can see here the fracture, which involves the rim of the orbit, involves the nasal bone, and probably involves the ethmoid bone there behind. You can also see this one, and you can see on the CT scan. Let's go to the fracture. Here it is. You'll see it right over here. You can see some air and fluid in the or isotense material in the maxillary sinus in the be, below the floor of the orbit. And you can see here the fracture and air bubbles that goes around it. Compare it to the contralateral normal maxillary sinus. You will see the fluid, maybe it's blood, I don't know, and the air and the fracture right over here. And also there is involvement of the area of the ethmoid bones, and also there is involvement of the nasal bone. So this is nasal orbito-ethmoidal complex fracture. Now, when we're talking about the classification, again, there are three types. The first type is a fracture that is not comminuted, and there is a one big part. And if we are looking on the medial canthus, we can't see it here, but it should not be torn. I mean, the medial canthus attach to this big fracture, and it's not torn. Now, this is type 1. This is the least severe one of the three. Now, the other two are, the second is a comminuted fracture, but again, the medial canthus is still not torn and still connected to the bone. In the third type, the most severe one, this part is torn and comminuted, but also the medial canthus is torn and not attached to the bone. So if we are looking on the classification system, we'll see again those three types. Medial canthal tendon is intact and connected to a single large fracture fragment. This is exactly what we see here. Big, large fracture segment. We can see here, of course, the tendon, but the tendon should be attached. And the second type is comminuted, but the medial canthal tendon is attached. Now, the third is that there is comminution, but also the medial canthal tendon insertion site is, let's say, torn and avulsed because the comminution of the fracture extends to the medial canthal tendon and avulses it. So this is the idea of the naso-orbito-ethmoidal complex fracture of the face, which with its Markowitz and Manson classification to the three types of it. And we saw some imaging in that regard. This is type 1 again. Thank you very much. If there are any mistakes or correction, please tell me. And thanks very much for Radiopedia for their site and the case. I can use it to teach. Thank you very much, and that's it.